Hi, this is Rob. So I wanted to do a quick video today. It's June 14th, Flag Day. I have a procedure today for heart ablation. So 61-year-old male, about a year ago, I started feeling a little lightheaded. And prior to that, I had an Apple Watch and it was telling me I had bradycardia. You know, my pulse or heartbeats were down from 42, 44, if it's into that for, it's either 5-minute average or 10-minute. But anyway, I went to the doctor. Actually, at that point, I actually felt fine. So he goes, "How do you feel?" And I go, I feel good. And he goes, "Okay, well, you know, let's go ahead. If you want to do a monitor, you know, like a 10-day heart monitor, we can do that." And I decided to wait. So I think a few months later, so prior to this, I had no, you know, I knew my heart would, you know, I guess they call it arrhythmia, but, you know, where you have the thump, 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 thump. Anyway, so I started getting a little lightheaded, just a little, you know. I was working still, I had stress, drinking a lot of caffeine, but so I went back in. They put a monitor on for 10 days, and when it came back, it showed like 20% or 22% burden PVCs. Well, at that time, yeah, PVCs. And then they sent me to the cardiologist. So this was my MD. He did you know, the stress test. The ejection fraction was, I guess, I don't remember exactly, but it's lower. It's on the bottom 50%. 40. I should have these numbers. I'll correct them. But anyway, it was a low end of normal. And then they did an angiogram, and it was fine. The stress test was good, and the angiogram was very clear. All my arteries. One of the things I did do is I cold turkey caffeine, and then I didn't stop drinking. I'm not a heavy drinker, you know, I have a beer once in a while. But anyway, I stopped drinking alcohol, and then I started getting this tinnitus, like pulsatile tinnitus. Then I thought, oh, so I started looking up stuff on that. You know, this is totally separate from the arrhythmia. So maybe I'll do a little thing on that. I actually went to UCLA for a cerebral angiogram, excuse me. And it ended up being all clear. They didn't see anything where you can get a possible aneurysm, or because there's an issue there where the blood goes up and the capillaries, and it comes back, where there's cross connections, and you might hear your heartbeat near your ear. So anyway, get back on track here. So today I went back. I went down to electrophysiologist. So scheduled an appointment three or 4 months ago, and he said, you know, yeah, we need to do something. So he said the risk was here and the benefits were way up here. So, and I already had 2 angiograms, right? So this electrophysiology, I guess, where they go in, and you've already probably looked up heart ablations. This is for PVC specifically. So I'm hoping, you know, I'm going to go down here noon today. So I've got, you know, less than 6 hours. I got to travel a couple hours to Sacramento. Dr. Bowers is my electrophysiologist. So I guess he does quite a few, you know, and when he does do the surgeries, I don't know if he does 3 to 4 or 5 of these a day when he does do them. So the only negative part, he said, is if you don't have the arrhythmia, right, when you're under or when you're in there. And the second thing is sometimes I guess the issue is too deep in the heart tissue where they can't take care of it with ablation. Then you'd have to do medical pharmacy drug approach. So hope I don't have to go there. I'm hoping that this heart ablation, they can narrow down the spot, this misbehaving as you'd call it. It's got to be done. I'm 61. I feel, you know, what happens, I guess over time your heart structure will change. And obviously if I have a lower end EF, that it doesn't help when it's not pumping right. So that left ventricle is when that's what's feeding your brain and your lungs. So I'd like to get it corrected. what's interesting is when I exercise, the arrhythmia goes away. So I try to be pretty active, try to do 10,000 steps a day, ride my bike, but when I'm at rest is when this stuff really shows up. So, and back to the 20% burden, I guess there's no triples really, or whatever that is. There's so many doubles, but a lot of it's single. So, they said I was in no danger of a heart attack or anything at that point, based on everything they knew. Okay, so I'm gonna go down and have a heart ablation. If everything goes well and I come back, I should be back tomorrow. I don't think we'll come back tonight. We got a place to stay the night if we need to. And I'll do a post video if I'm able to do so and see how it all goes, and then I'll upload it. All right? Okay, well, everybody have a good day. Thank you. I had the ablation yesterday for the PVCs. I went in at noon and I didn't leave till like 7. The issue I had was, I think I was probably 2 hours in the procedure, so they have to do the mapping and everything else, but I tell you what, I was in a lot of pain, so I don't know, I guess mine was, they usually go through the vein, and then they actually had to go through the artery on my femoral, so they had to get through both sides of the heart, evidently, to get what they needed to get, and so I think it was a little more tricky, but I had some major pain coming out of there. Yeah, and I had to end up getting, and I don't think my case is probably typical, so, take that with a grain of salt, because there's some people I saw in there that were coming out and they seemed fine, so I don't know. You know what I mean? That was the only one going. I think it was at the very end of the procedure. I'm like, and either it woke me up because I don't remember a lot of it at all. It was just like, I was really to the point where it's like, it's not tolerable. The pain was not tolerable in my chest. I could take a lot of pain, it seemed like. I made it through, so I got wheeled out. So at 4 o'clock, I went in at 2, started, and 4 o'clock they wheeled me back to, when you're done with the surgery, or the procedure, I guess, if you want to call it that. I was complaining about pain, and it took probably a half hour before I got some fentanyl, and they didn't give me very much. And the next person, it was like a half hour, 15 minutes later, I said, I can't take this pain. On a scale of 0 to 10, it was probably 8, 8.5, 8. And then once the second part, the fentanyl, they gave a certain vial, but they only gave me a tiny bit. So they gave me some more. And then I think I got down to about a 5. You know what I mean? It was one of those things where I'm not comfortable at all, but something I can deal with. Anyway, the doctor came in and talked to me, and during that time, and they did an EKG after, and I just did my heart monitor here. This is but yesterday I didn't. The PVCs were eliminated. I had about a 20% burden. I feel better today. So after the fentanyl took the edge off, then they actually gave me 1,000 milligrams of Tylenol, and so I left about 7:30 because I was almost I had the choice to stay overnight or not. It was one of those things where you had to make that call, but I think the Tylenol finally nipped it. After about a half hour, I felt like, okay, I can handle this. My real concern is what happens when it wears off at 5 hours. So luckily we had a place right across the street. It was real nice. Went to bed at 9 and woke up at 11. I didn't really have any pain, but I took 2 Tylenol then, because that was like a 5 or 6 hours after. And then I went back to bed and got up around 4:30. Didn't have very little pain, or discomfort, I guess I call it. So I felt a lot better. And then, and it's like yesterday, backing up, I think it was at 7 o'clock, they brought me some kind of ham and cheese sandwich, which I did eat. So at this point, we drove home today. It's about 2.5 hour drive from where where I had the procedure done. It was in Sacramento and California, and I'm feeling pretty good now. I got to wait a day to take the Band-Aid off down there. It's got a little blood showing. They shave you completely, and so I walked upstairs here. It's whatever 10:30. Tried my Omron heart monitor, and zero arrhythmia. It counts up to 3 irregular heartbeats, which was pretty normal. I mean, but it's 0, so I'm not feeling any. And my heart is still, there's a little ache, and I think it's going to take time, to heal, week to month or maybe even longer. But this is the idea that, and I haven't had any lightheadedness or anything like that, so that's a good thing. So anyway, this is day 2. I just wanted to document it. All right. Talk to you later. Bye. Hey, this is Rob. I didn't do a video yesterday at day 3, but this is 4 days into my cardiac ablation procedure. It was performed on Friday. So I think the only thing I could say about yesterday was I felt like I was a little, I wouldn't say lightheaded. It just didn't seem quite right. It's hard to explain, but prior to all this, I'd get a little lightheaded here and there. And it's really probably possible due to the PVCs I was having. It was about 20% burden. And so today I was drinking a little decaf yesterday, so today I'm not drinking any coffee. Decaf coffee, at least. I was drinking water. So my groin's healing up, feeling better. So they told me not much activity for the first week, heavy activity. So I think I'm going to go take a walk today, but I'm feeling pretty good. My heart's right on sync, evidently. I check it once or twice a day with my blood pressure Omron, and it'll actually measure if there's arrhythmia up to 3. Any more than 3, it will only do to 3 max. But anyway, each time I've tried it since I got home, after day 1, day 2, day 3, I haven't ran it today, but what I do is a lot of times, if you're sitting in bed or you're sitting and you're watching the second hand, you can, I used to be able to, just check your pulse for 60 seconds, and a lot of times I always have missed beats, right? 20% of the time, so it shows up, but I haven't had any since the procedure, so which is a good thing. I think it could take several months, I guess. Your heart is resetting, my understanding, and I haven't really had any pain. I haven't had to take any Tylenol or anything like that, so I'm taking blood thinner because they had to go through to the other side of the heart. They had to go to both sides. They used my vein and my artery. They were originally just planning to do the vein, so to get where they needed to go, evidently. I'm going to have a follow-up with my electrophysiologist the first week of, I think it's first week of July. So so I can talk to him about exactly, what that looks like. Let's see. Actually, it's first week August, so they're giving me 2 weeks, basically, or 2 months. So June, July, August. I'll have a follow-up. I'm going to go see my cardiologist, I think, here in another week. So far so good. Like I said, I'm hoping when I come out of this, I won't have any lightheadedness and stuff. I'll be able to kind of build my strength back up, because I think that's what the doctor, said it would be in ideal conditions where they do this correction, your heart's pumping the way it's supposed to, all the ventricles and atriums, and then it kind of readjusts to that, and then you strengthen it and move forward. So I'm looking forward to that. I'm getting past this little speed bump. Hopefully I'm 61 now. So there's a lot of things I want to do, and I was doing stuff I wanted to do as well. But it's one of those things, you go from feeling well to not feeling great. And so I ended up retiring because I actually went back to work. I retired when I was 57, and then I worked a little bit here and there, and then they had a hard time getting people, and so I went back to work for, it was like 13 months, and then I started about 12 months into that. I was getting a little lightheaded, so I don't know if it was stress and caffeine. Not really sure. A lot of people are having this procedure done, evidently. I mean, they're doing 5 or 6 a day down there. So, yeah, so I'm thankful for my procedure and how things are progressing. All right, I'll check in the next day. All right, have a good day. Bye. Hey, hello, this is Rob. So I had the heart ablation June 14th, so it's been 7 days today. I could say of the 7 days, anytime I've checked myself on my monitor, heart rate monitor, I've had no PVCs. I had a PVC, about 20% burden, 22% roughly. So that's good news. It's been a rough, you see my other videos, it's a little rough going through that process, at least for me. One of the things that's happening now, it's been a week, so I'm adjusting pretty good. I had a little dizziness and lightheadedness here and there, and I'm thinking it was probably, I'm on blood thinners now it's going to be, I have to take them for a month because they went on both sides of the heart to do the procedure. So when they do one side of the heart that goes to the brain, they, for precautions of no stroke, they put you on blood thinners for a month. And then I also take Prilosec I'm going to have to take that for a month. So I guess because of the esophagus, I don't know what goes on in there, but it's extreme enough where if I had to go to the emergency room or something, they said you cannot put a tube down your throat and esophagus because it can become damaged. So I think it's tender. So anyway, I'm taking Prilosec, which is like an anti-acid, I guess. I had some indigestion a few of the days, the last, not last night, the 2 nights prior. So I tried to sit up in bed and, eat dinner around 5, and not anything too exciting or spicy, really. I've never had indigestion really in my life, so it's something new for me. And then today's better as far as any, I don't feel dizzy or anything like that, or lightheaded. I guess there's a difference between the two. But anyway, so yeah, 1 week down, my groin is healing nicely. And then what else do I have to say? Yeah, I'm stoked about it has a little EKG on my heart monitor that only counts up to 3 irregulars, which used to max. I mean, once in a while I get a reading without any, but every time I take my blood pressure in the morning and maybe at lunch and in the afternoon, my blood pressure's fine, heart rate's fine, and I used to have all kinds of trouble with the machine because it would come up with errors, E7 errors, and when it can't get you, because I think if you got a low, it considers a low heartbeat rate, especially when you're missing, with the PVCs, because it's like thump, 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 instead of thump, 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 thump. So it always showed like a lower, beats per minute. So anyway, but of all the time I've done that in the 7 days, 2 or 3 times a day, it's never caught one irregular heartbeat, not one. So I'm thankful for that. So it looks like so far so good. It would be nice if I can get through this blood thinner. So it was 7 days of no lifting or anything heavy. So I started doing little walks after 3 days. So 3 days you're not supposed to do really much of anything. So I'm trying to get back going. All right. Well, I hope you enjoyed these videos. I think I'll do one at the 1 month term, or if something changes, if it stays consistent like this, there's not much to do. So anyway, if you have to have the procedure, I think you get the right doctor, you can be in good hands and take care of that irregular heartbeat, because it's nice, not having that. And I think my understanding lastly is, it could take several months for the heart to heal, for everything it does based on the damage that was kind of done to it, minor amounts based on trying to stop the PVCs. But So I look forward to, a nice regular heartbeat, which I have right now, but the heart healing like it should. So, all right. Take care. Have a good day. Bye.